Okay, so joint attention. Joint attention, um, don't worry if you don't know what it is, I'll explain it in just a minute. But joint attention is something frequently found in people with autism to be, I don't know, decreased. I always hate the negative words, lacking or whatever. More difficult for people with autism. So, what is joint attention? So, we can define joint attention as the ability to maybe we see a dog at the park and a 1 year old child sees a dog at the park and they look at the dog and then they look at their mom and then hopefully their mom might, look to see what they're looking at and then she would interpret and look too that that's something that's caught their child's attention. Now you can see how this would be important in terms of a skill set to learn social nuances. And so, for example, if a child had looked at a dog and looked at their mother, looked back at the dog, and then looked back at their mother, and their mother had looked at the dog and had this fright of fear on her face, you could see how a child might start to learn to be afraid of dogs. But let's backtrack a minute and find out what we actually need in terms of a brain-based perspective to do joint attention. So we have to have the ability to, on a very basic level, move our eyes to look at something, quickly move our eyes to look at something else, look back at that something. So we need those eye movements, those voluntary eye movements. The second thing that's related to the dyspraxia is that we need to be able to interpret if we see somebody looking at something that's captivating their attention. So you can think about that as really interpreting a meaningful gesture. Looking at something has meaning. And so when we're looking at something, we're usually attending to it. Then you have to be able to transfer your eyes back to mom or the other person you're with and then interpret their reaction. So what is that reaction? So that's a praxis skill set. So if you are seeing somebody looking at something, you have to be able to interpret that means they're interested in that for some reason. And so just that simple gesture of an eye movement needs to be able to be interpreted. So we know that kids with autism have difficulty with praxis, and they more so with the production of gestures, but also with the interpretation of gestures. Another thing related to praxis is sometimes with joint attention, instead of just looking, you might point. And that's another big indicator that a child may be diagnosed with autism, is if they don't point. And without getting into all of the details of it, there's a particular form of dyspraxia that's related to isolating your finger movements. And so you can think of pointing, again, as isolating a finger movement, as well as being able to interpret the meaning of gestures. So we need to be able to have voluntary eye movements. We need to be able to interpret gestures. And if we're going to fully use joint attention, we need to be able to point to show somebody. So we know that the interpretation of that eye gaze is impaired in people with autism. Their brain connections don't process that well. Then you can think of the ability to produce the gesture of pointing, and that's a difficult thing for people with autism as well. The third thing, the eye movement, there's been a lot of research on eye movements, and to kind of sum it all up, we can think of it, there's different kinds of eye movements, and it can get really complicated, but for our purposes, we can think of it as two different eye movements. One is voluntary and one is reflexive. And I describe it to people that if you're sitting in a car and reading a book and you're moving your head, you're able to keep your eyes focused on the page. But then if you're sitting still and you try and move the book and keep focus on it, you're not able to. And that's because that voluntary movement to keep your eyes on the page is a different pathway that's not reflexive. Whereas the vestibular one, where you move your head and your eye stays on the page, that is a reflex. And there's evidence that that reflex is stronger in individuals with autism. So if you start thinking about all of the different brain pathways that need to be well connected in persons with autism for them to be able to do this, you can think of it as a brain, a differential brain connectivity, rather than that the child isn't interested, doesn't care about what somebody else is thinking. It's just that their brains aren't working that way. So next, our next session, I want to talk about something called thigmotaxis, which is a big scientific word, and hopefully that doesn't intimidate you. But you can think of it as being stuck on external cues. So we'll get to that in the next video.